United Healthcare, Coalition of Texans with Disabilities, Raise Your Voice 2020 Advocate Connection Program, October 28th, 2020, Mental Health in Schools.
My name is Jolene Sanders Foster. I'm the Advocacy Director at the Coalition of Texans with Disabilities. I am a white female with long brown hair and black rimmed glasses. In my background is random items picked up antiquing and pictures of my kids' art. So today, before we get started, just for those of you who are familiar with CTD, or the Coalition of Texans with Disabilities, we've been around since 1978. We are a cross-disability organization, meaning that we touch on all different types of disabilities, all issues, across settings, across the lifespan. I typically work on children's issues, early childhood, special education, mental health, and school discipline. But the rest of our team works on a number of other things. And so as we move through this series, you'll see, and if you review the sessions that have been held before, you'll see that we've covered a number of different things, from voting to medical cannabis, special education, and ECI. And this series will continue moving forward with other issues. So today we are talking about mental health and school discipline, two things that are really important to CTD. So to give you an idea of what Raise Your Voice is, if you haven't attended one of these sessions before, it's really an opportunity for us to hear from you, for us to share some information. And today we have two incredible guests who are experts in mental health and school discipline, and excuse me, and so they'll be sharing some information with you. But it's really just, we want you to be involved. We want to get your feedback. We want you to have access to be able to raise your voice and to advocate. We really, it's really important to us at CTD to have the feedback, the input, the expertise from self-advocates, from family members, from all of you who are navigating services or supports, to share your challenges and even share your successes. So with that, what you can expect from us is that we will value your input. We will take that feedback and we will incorporate that in as we move forward to advocate during this next legislative session. Speaking of which, we don't know what that's going to look like yet. We're waiting, and as soon as we know, we'll share opportunities with all of you on how you can get involved, how you can provide comments, how you can contact legislators, what issues are coming up, and we'll continue to track that and share that information with you moving forward. So real quick, before we get started, we would like to do a poll for all of you. This is anonymous, and we will share the results with you afterwards. And the poll is on the screen. This is about asking about your policy priorities. So what is your biggest concern or concerns in this area of mental health and school discipline? And you can choose all that apply. Early childhood mental health, that could be from 0 to 5. School-based mental health and behavioral health. School discipline. The school to prison pipeline, if you're not familiar with that term, it's related to discipline and how discipline within schools can possibly lead to harsh discipline, or ineffective discipline can lead to criminal justice involvement. And then maybe it's something else. You can select something else, or maybe none of these. So we'll give you some time to go ahead and tell us what your priorities are, and then we'll share that poll with you in just a little bit. And like I said, this poll and then the feedback that we will get from you today is really important to us, and it will be used as we start planning our advocacy efforts moving forward. Let's see. So I think Jennifer, as soon as everybody's had an opportunity, she's going to share that. Okay, so it looks like about 33% mentioned early childhood mental health, 67% chose school-based mental health and behavioral health, 67% also chose school discipline, 61% school to prison pipeline, and 17% said something else. And we had 0% of none of these. So these, it looks like all of these are at least important to all of you, or at least some of them are.
Well, it looks like Jolene might be frozen. That happens sometimes. So why don't we just keep things moving? At this point, she was going to introduce our speakers, Josette Saxton, Lauren Rose, and Jennifer Toon. So I will let them do their own introductions and audio description. And we'll really get into the topics that we're talking about today. So Jennifer, why don't you start us off?
Sure, thank you, Laura. My name is Jennifer Toon. I am the Mental Health Peer Policy Fellow here at CTD. I am a white woman with short brown hair, black rimmed glasses, a nice plaid button-up shirt, and in the background are posters of Wonder Woman and cats dressed as Wonder Woman. So really excited to hear from our guests today, and I'll pass it over to Josette.
Thank you, Jennifer. Hi, everybody. My name is Josette Saxton, and I'm the Director of Mental Health Policy at Texans Care for Children. We are a nonprofit organization that focuses on children's policy. We cover various areas of child well-being. I focus on mental health. I am a white woman with long dark hair and glasses, and behind me is a bookcase full of, I think, just different pictures of my family and knickknacks or whatever, and potentially a wandering cat that might come through at some point. So would Laura or Jennifer, should I have Lauren introduce herself, or should I just go into my 10 minutes? I'm not sure.
Yeah, why don't we have Lauren introduce herself first, and then we'll get underway.
Great.
Great, thank you. Good afternoon, I'm Lauren Rose, the Director of Public Policy at Texas Network of Youth Services, also referred to as TNOYS. We are a network of youth-serving providers who represent services across the full spectrum, from community-based prevention services to residential treatment centers and emergency shelters. And we focus on policy change at a systemic level across various youth-serving systems. And my visual description is I'm a white woman with long brown hair in a brown sweater and peach framed glasses. And my background is very boring. It is a plain gray wall with a white closet door and a window with white blinds. And should I pass it to Josette, or does anyone want to do anything else?
No, that's good. We're ready for Josette.
Great.
Okay, great. Thank you. Thanks, Lauren and Laura. So yeah, I'm excited today to be able to join you and talk a little bit about mental health in schools, or school mental health, or student mental health. People use various different terms when they're talking about this policy issue area. But one of the things that I think we can all agree on is that schools really will play an important and necessary role in helping students, and I'll say even the adults in a school, recover from some of the challenges that we know that COVID-19 has really, brought with it beyond the physical health concerns. We know that the 86 legislature in 2019 prioritized the mental health of students even before COVID-19, was on our doorstep or right here. And so thankfully, what we know is that the legislature has already put in place some, first steps, a nice framework for schools to be better able to respond to things like trauma and grief that our kids, and I want to mention too, also our school staff will be experiencing when they are back in school or when they're there right now. We also know that because of the pandemic, that rates of trauma, mental health, substance use concerns, and even suicide risk are projected to sharply rise, and that it's going to affect kids and adults that not only threaten, I think, their health and well-being, but really it also affects how well they're able to engage in their learning. So one of the things I just wanted to quickly go over is some of those things that I mentioned that the legislature did in 2019 that I think really put Texas schools sort of in, help them to get in front of how to address student mental health, social emotional awareness. So largely there were 3 bills for wonky people that like bill numbers. I think you can look to SB 11, HB 18, and HB 19 that offer different types of pieces related to mental health and school climate. But in summary, I just wanted to share that now school districts are required, and charter schools, to have plans and procedures in place to create safe and supportive learning environments for all students. So this includes making sure that schools, provide positive and supportive learning environments that are trauma informed and that also address the social emotional aspects of learning. They're required to have plans in place and strategies to build student skills related to social emotional learning, things like managing emotions, relating to other people, and making responsible decisions. And they're also required to have strategies in place to both prevent and address mental health concerns, substance use, trauma, and suicide while students are at school. And then also they have to have plans in place to support students once they return to school following if they had to receive treatment for mental health or substance use issues. And so what I want to mention here, though, is it's great that we now have school districts that we know, or they should be, actively thinking about what do they have in place in terms of school-wide policies and practices, individual, interventions that they, can offer students addressing these different issue areas related to mental health. But one thing, though, that the legislature or that the legislation from last session didn't do was really say what exactly they needed to look like, those types of plans and procedures and what types of strategies. However, the Texas Education Agency has been working to put out some guidance to districts on how to make sure when they're developing these plans that they're really doing things that are effective and that are appropriate. One of the opportunities I think we have going into this next session is to have the legislature continue to support this TEA's efforts and then also expand, because I will mention the Texas Education Agency didn't get any funding to really help schools implement these planning and processes on how they're going to do these things. So that is, I think, one area going forward into the next legislative session that I think the legislature can help out with. I also want to mention that as part of the SB 11, the legislature established a school safety allotment, which really is sort of like a bucket of funding that is provided to schools at the beginning of the year based on their average daily attendance that school districts can use to support school safety, which is defined as a whole bunch of what I consider hardened activities, things that will provide security and safety to sort of the physical facility structures. So things things like cameras, things like fences or locks, and then also like things like school officers. They're also allowed to use that funding for mental health related services and supports, although it's not really defined what that is, and it's not clear on how many schools are actually using that funding to support mental health strategies. One thing I will note is that that allotment funding, that spending that goes directly to schools, is dependent upon how much funds the legislature appropriates for it. So it can waver from session to session, from biennium to biennium. I will say that the legislature at the funding level last session, it turned out to be about $9.72, I believe, per student. So for districts that have a large student population, that could be a significant, an amount of money that they can, do things. But for smaller districts, it might not be, likely is not enough to even do something like, let's say, hiring a guidance counselor or a social worker who can just focus on mental health. Another thing I want to mention is that as part of SB 11 that I think folks would be interested in is there was a behavior threat assessment that is a process for identifying potentially threatening or or I should say potentially harmful behaviors to self or others. If it's implemented the way it's intended, it should really do a good job of bringing a multidisciplinary team to come together and sort of empirically look at, is a behavior, is it a true threatening behavior to self or others? And then if so, what are some interventions that can be provided to help address that underlying need? And ideally, what it would do is separate what is probably credible threats from non-credible threats. And I think research shows that when somebody thinks a student, is maybe exhibiting some threatening, sort of behaviors, is that 80% of the time they're not, it's not a credible threat. Instead, it's a way though to identify student need and for the schools to provide some interventions to help address that need, including helping to sort of refer families out for services and supports in the community. One of the things I know that folks are concerned about is how the schools are actually going to implement these behavior threat assessments, knowing too that students who have are receiving special education services, students with disabilities, students with mental health concerns, as well as students of color, are often disproportionately diverted into or sort of identified for troublesome or challenging behavior. So it's really important that we look at the data that's collected on, that is required to be collected on these behavior threat assessments, and to find out, again, who is, receiving these assessments, and then also what is happening to the students. What are schools deciding on, like what interventions are they choosing to address underlying need? Also, one thing that I think is really a great promise for how schools address student mental health, both school-wide and also providing individualized sort of services and supports, is a safe and supportive school program, which all schools are now required to have in place at each campus, that is supposed to really look at the multi-tiered system approach of providing universal supports as well as targeted supports for kids that might need additional sort of interventions, and as well as those kids that might have sort of more specialized and sort of intensive needs related to mental health or substance use issues. And again, but the idea is having a plan in place on how to address this, and and having it be grounded in effective practices. Now, TEA just had closed public comment on some rules for the Safe and Supportive School program, and they look pretty solid to me. We will have to see once they are adopted again, what is really, how that could be a model for schools to address some of these issues. What I want to do now is, because I'm probably running close to time, and think more about, okay, so like I said, I just wanted to sort of recap. There are some good things that were put in place last session. Thank you, Texas legislature, for that leadership in addressing mental health in schools, even before COVID came here. But now that we have COVID, the needs have really grown all across the state, every age group. Kids that had mental health concerns before the pandemic are really at risk. But now there are kids that haven't had any pre-existing concerns that are struggling now, and that it's really important for our schools to address it, not only because of for their mental health and well-being, because we know schools aren't mental health, providers, but there are things schools can do to really help kids cope and mitigate the effects that these outside concerns are having, so that they can be better learners. So one of the things I think that the Texas legislature can do is really, provide some leadership at the state level, or require some leadership to sort of guide a lot of efforts. So we have TEA that's doing some things. We have the Health and Human Services Commission that has some pieces. We have the Texas Child Mental Health Consortium that has some pieces. And then we also have the Texas School Safety Center, but there's no really one entity that has the authority to sort of coordinate these efforts to make sure all of these different pieces from legislation really fit together in a cohesive manner. Also addressing that TEA didn't receive any funding to help schools try and develop these plans and strategies. And for some schools, they're already doing this. They already know how to do this. But schools in rural areas, schools that don't have a lot of resources in the community, this is a whole new ballgame for them. And so they really need additional and enhanced training and technical assistance on how to develop plans and implement plans. I think also I talked about the school safety allotment that was passed with SB 11. We need to make sure that that continues, and I believe TEA does have that in their legislative appropriations request. But really, I think the legislature can say that a portion of that must be used or needs to be directed towards mental health services and supports. There's a lot of money that's been given to schools to address that facility hardening, even outside of SB 11. What we need now is to address the crisis that's happening today and in the years to come, and have that funding be dedicated to helping schools address mental health concerns. One of the last things I want to mention before I pass it over to Lauren is looking at school discipline practices and how they relate to substance use prevention. So we know that schools historically have been addressing substance use from a disciplinary sort of response sort of framework. If a student, has been identified as under the influence of drugs or alcohol while they are on campus, they're supposed to be removed from campus. Sometimes that might be appropriate. Research shows that effective substance use prevention does require, some of these, sort of responses and consequences. However, we need to make sure that those decisions are being made according to what science says helps kids who might be struggling. And then also recognizing that if they're using substances while at school, and if they're doing it as a coping mechanism for some underlying issue, really what would help that student is connecting them with services and supports either in school or in the community to address that issue. And so I think our schools need more guidance on how they can do that, how they can align their substance use prevention and intervention strategies and plans with the discipline, sort of responses to make sure that the focus is on helping kids, not just strictly punishing them. And then actually, I think I might have lied before when I said that I was going to say one more thing. One of the things that I wanted to mention too is I think the legislature really needs, we know that funding, is going to be is an issue, but when, feeling confident that there is still some federal COVID response dollars that are available that can be tapped into, as well as future COVID relief funds that, may come down to Texas. We really need to have the Texas education agencies prioritize some strategies related to addressing social, emotional, mental health and wellness of our kids and our students and our staff, the big people that are at school. With that, I'll pass it over to Lauren to talk a little bit more about, I think, some of those disciplinary responses that were addressed last session, and then also looking forward to this session.
Great, thank you, Josette. So I will acknowledge that I consider school discipline and the school to prison pipeline to be one and the same. So I will actually be focusing, I guess, more on what was referred to earlier as the school to prison pipeline. Mostly I'll be looking at exclusionary discipline and then policing in schools. And I'm hoping to give like an overview of both of those and then talk about some policy changes. So When we talk about exclusionary discipline, that means removing a student from their classroom. So that would be in-school suspension, out-of-school suspension, placement in a disciplinary alternative education program, or a DAEP, or expulsion to a juvenile justice alternative education program, or a JJAEP, which is run by the Juvenile Probation Department. And what we see is that youth with disabilities and students of color, youth of color, are overrepresented in exclusionary discipline. The vast majority of exclusionary discipline is what we consider to be discretionary, which means in statute, schools are allowed to take disciplinary action and remove the students from the classroom, but they are not required to. And then there is mandatory discipline, which there's a list in statute for violent and drug offenses that are required, students are required to be removed from the classroom. But I should say that that requirement really doesn't exist anymore. Schools are given the options or are required to look at mitigating factors that led to the behavior and whether or not a student should be disciplined at the level of removing students from the classroom. The data shows that's not working nearly as well as I think people had hoped when that change had been made. But what we know about exclusionary discipline is that it removes students from the classroom, which means that they get behind in learning because they're not learning when they're out of home, or they're in, even if they're in school, but in school suspension, they're not learning at the same rate as their students. So that leads them to get behind. And oftentimes that leads to frustration when they get back to the classroom. And research tells us that these students are then much more likely to end up justice involved later. So in the juvenile justice system or in the adult criminal justice system. And so there's been a number of, and so that's the overall exclusionary discipline. And then I will note, and this hasn't been something that I've worked on a whole bunch, but there's been some research around what has been dubbed as shadow discipline. And that is discipline that is happening in schools that schools aren't required to report. Like, we know when in school and out of school suspensions are happening, when expulsions are happening, but the shadow discipline, schools aren't reporting it to TEA. And so, you know, there's been some research and surveys done where we've learned that students are being pulled out of class and parents are being called and saying, pick your kids up for the rest of the day. And just even that short period of time being removed from class or multiple classes throughout the day is still going to help put them behind and push them into further disciplinary issues down the road. And then in that regard, I will acknowledge during the last legislative session, Teen Roy's worked on 2 bills that passed related to exclusionary discipline. One specifically prohibiting the use of out-of-school suspension for students experiencing homelessness, recognizing that if we're suspending them from school and they don't have a home to go to, they are either going to the streets to potentially, like, definitely not an option to really be studying, and potentially getting themselves into more trouble. And then a second bill that added to the list of mitigating factors that schools must consider before they can remove a student because of a mandatory. They have to consider whether or not that student's housing instability because they are homeless or because they are in foster care, whether that was a driving factor in terms of the behavior, or if removing them from class and putting them into that situation would exacerbate those problems. So those 2 issues we're working to address exclusionary discipline. I do think that there's a lot more that needs to be done around that issue to keep kids in class and learning. And then second, I wanted to touch on school policing. We have seen the use of police in our schools increase over the years, particularly around concerns about school violence. But we saw that increase really starting before that as well. And I think there are a number of concerns that we can have around school policing. First, just the climate that it creates by having an armed officer walking through the schools, but also recognizing that our schools are some of the safest places for youth to be on any given day. And what that really ends up meaning is that the school police officers don't really have that much to do. And so they end up getting pulled into very minor behavioral issues that should be addressed in the classroom, and end up arresting students, for issues that when I was in school would have been addressed in the classroom, potentially an in-school or out-of-school suspension, but not immediate justice involvement. And on that, there's a number of different research and data points out there that I wanted to share. In terms of arrests, we do know that 28% of all kids involved in the juvenile justice system, their referral came straight from behavior that happened in school. And if you're looking at 10, 11, and 12-year-olds, their involvement in the juvenile probation system, 46% of them came straight from school. And that is, I mean, and Josette hit on this, some of that is for substance use or substance, like drug possession at school, but some of it is also schoolyard fights and other issues like that. And then research tells us that those youth obviously, I guess is not the right way to say it, but disproportionately Black and brown youth and students with disabilities. And we don't have specific data on referrals to probation from schools on students with disabilities, but we do know particularly 10, 11, and 12-year-olds are even more in the justice system, are even more likely to be students with disabilities than even the older youth where the disparities are as well. That's a good question, Dennis. And I ask that question all the time as well. Dennis asked, why would 10-year-olds ever be referred to the juvenile justice system? And I ask that all the time. And then we also know that, and I'm talking about the data of being referred to juvenile probation. There's not a lot of data around police actions in schools collected by TEA. Like the data that I'm talking about is from juvenile probation, but we also know that 17 and 18-year-olds are in our schools getting arrested, and very few districts report that data in a way that you know that they're from schools. But we do know when they do report it, that those youth are disproportionately students with disabilities and students of color. Let me just check my notes real quick. And so that's when we're talking about the school to prison pipeline. Exclusionary discipline can potentially lead someone to prison, but also minor misbehavior can just lead to an arrest and straight into the justice system as well. And then on that note, just a few things that we're looking at, and we know some other folks are looking at in terms of addressing this issue. One is just increasing the supports in schools to, one, prevent the behavior. And Josette kind of covered some of the safe and supportive schools recommendations that we would say as well. But then also like encouraging things that would prevent the behavior, but also address it in the classroom. Oh goodness, I just forgot my word. Restorative justice, that came to my head. Someone's about to say it, I think. But encouraging restorative justice to be used in the classroom. And then also, from our perspective, when we're thinking about how often students are being arrested in schools, particularly 10, 11, and 12-year-olds, and we know that almost half of them are coming straight from school to probation, we're recommending that we actually prohibit 10, 11, and 12-year-olds from being justice involved. And so like no matter if it's school or not, that arrests couldn't start until at least age 13. And then also for the same reason that we know that students are in school at 17 and 18, making sure that we move 17-year-olds into the juvenile justice system so we can get a better understanding and schools can work with them. And that's kind of what I was planning on focusing on today, but let me know if there should be more.
Lauren, can you hear me?
Yes.
Okay.
I don't know where that came from.
Sorry, I'm
Jolene.
Technical difficulties today. Real quick, because this is something that we've been hearing since COVID, is the impact on students and the types of discipline and the reasons for discipline. Mm-hmm. That may be, behavior that's a manifestation of either a disability or trauma related to COVID. Mm-hmm. What are you, what is that? What are you hearing, or what does that look like?
So, I would say kind of the similar that Josette has, knowing that more kids are going to be coming into our classrooms having experienced trauma and ongoing trauma because of a multiple of reasons. I would have concerns that unless schools are prepared to address those behaviors in the classroom, which nothing tells me that they really are, we're going to see an increase in a lot of these behavioral concerns that are leading to both exclusionary discipline as well as arrests and justice involvement.
Yeah, I wanted to sort of add to that, or just saying that research shows that the effects of trauma often don't manifest, or until months, if not years, after, let's say, a traumatic event. And so it's really important that not only do our schools and our state focused on helping students sort of address the effects of remote schooling, the effects of the pandemic and the uncertainty and the loss that children and families are experiencing now. But what I really worry about too is what happens a year from now, 2 years from now. I think right now I think people sort of understand, and we're sort of in a honeymoon period where I think people will be, let's say adults in a building might be more understanding or aware of some of the behaviors stemming from something underlying, some underlying issue, be it a disability, developmental delay, or trauma or mental health concern. But what happens again a year from now, 2 years from now? I think about after Hurricane Harvey, that was an acute event. It was a goal, an event that it was obvious that there was trauma, but it was a one-time event. This is something that is stretching on and will continue to stretch on. And so I just want to go back and say that it's really important that we look at the way schools are addressing it right now, that they understand the effect of trauma and know how they can, what are things that they can do within school to address and mitigate that trauma. It's not just about referring them out for treatment, although many times that is an appropriate response. But there are things that can be done in a school to really help kids overcome any challenges they might have. And again, reminding, it helps them learn. Kids aren't going to be able to learn if they are, if they're focused, or if they're struggling, if they're challenged. I mean, that just goes back to, basically, brain science. And we know that trauma and anxiety and stress is what's those parts of the brain are going to be activated, and that will interfere with the parts of the brain that involve learning and more complex thinking. And so we need our schools to understand that basic science, and understanding of how stress and trauma and grief affects students learning, but then also knowing that this is not something that once we are outside of the pandemic, like, let's knock on wood, hopefully soon we will have a vaccine, we will have it under control, but knowing that the lingering effects are going to be lasting for a long time. Wanted to mention too that Elise Harris, and welcome Elise. I just exchanged some emails with you earlier in the day, but yes, actually children, she has a question about, is there any data on children in foster care being disproportionately affected by school discipline in Texas? I would say yes. Big yes. I would say that if I recall, that is probably the one sort of subgroup of students that has the highest rates amongst, different way you can disaggregate data that has different, in different groupings. Kids in foster care have it, the worst. And so I also wanted to mention too, and I'd be happy to sort of help out and share some data sources that showed that, because I know that the Texas Education Agency did do some deep dives specifically on youth in foster care to sort of uncover some of the trends in that area.
And I would note on that, part of the push to eliminate some or reduce some of the discipline practices against youth in foster care and youth experiencing homelessness was specific because of the data that showed that they're experiencing at a higher rate. And I think part of that is racial disparities driving that, because we do know that also youth in foster care and youth experiencing homelessness are also more likely to be Black and to a lesser extent brown, and we know that they're getting disciplined at much higher rates.
Thanks, y'all. We do need to move on with our agenda. So Jen, if you want to take it from here.
Sure. Thanks, Laura. And first of all, let me just say, Lauren, Josette, thank you so much for being with us this afternoon. This is a powerful discussion that I wish that we had several more hours to to talk about it because it is important, and we have so many shared priorities. So we appreciate your expertise and definitely your passion. So thank you for being with us today. I do want to real quickly take a moment to share with everyone what CTD is currently working on around these important issues. First of all, we want to protect the gains that Josette mentioned about last session concerning mental health and school discipline, and continue to advocate for those appropriate, effective behavior supports for students. We've really been looking at that shadow discipline, known as informal discipline, as Lauren told us about, that disproportionately impacts students with disabilities, such as things as school-initiated pickups. We're addressing early childhood mental health and discipline in early childhood settings before kids even enter school. And we are currently working on reforming use of force laws that will help protect students and hold bad actors accountable. We're also looking at home visiting and respite programs because, you know, we want to make sure those are protected and kept in place because we know that they decrease the likelihood of abuse and neglect. And the last two things that I really want to mention are not just professionally, but personally really important to me. And that's to make sure that students are not punished for manifestations of their disability or even trauma related to COVID-19. And we're really working hard to improve the access to comprehensive integrated mental health and IDD services within our communities.
Following small group discussions.
So hopefully that was a good experience for you guys. And we just want to take a minute to kind of debrief and share out, from your groups, if there are specific things that were discussed in your group or recommendations, or maybe it was a question. Maybe you don't have a recommendation, but you have a question about something, or there's something you want to know more about. So, and again, you can use the chat box, or you can unmute yourself and share. We just kind of
we're actually almost at time, so I think
okay,
let's just do chat. You can always email us as well.
Okay, that sounds good. Thank you, Laura. So you guys can just enter in chat. Sandra says we're having technical difficulties. I was in that room, and yes, I probably cursed it. I've been having difficulties all day, but if you guys will just enter in the chat box anything that that sparked your interest, or anything that you might be maybe you want to advocate for. Let's see, Josette, school discipline issues were most of our discussion.
Jolene, while people are typing their answers in, would you like to thank our sponsors?
Yes. So we will have more sessions coming up. We are skipping the next 2 weeks, but we'll be back on November 18th and we'll be talking about access to medicine. And obviously, we wouldn't be able to host these events without the support of our sponsors. So we just want to thank United Healthcare, Amera Group, Pharma, CDS in Texas, Superior Health Plan, Amgen, AstraZeneca, DentaQuest, Bristol Myers Squibb, CareSource, MCNA Dental, Molina Healthcare, Shield Healthcare, and Sutera, Texas. So there's some good feedback. Question on what disciplinary actions are being taken during virtual learning, COVID and mental health. Focus on teaching coping skills through creativity. Dennis mentions recognizing the opportunities for holistic growth. I don't know if I've missed any, Jen, if you saw any data about social workers in schools. Awesome. Well, I know we have about 1 minute left. You guys have any other recommendations or any questions? And like Laura said, you can also send us questions or your thoughts via email. You will get a follow-up email with a link to, you'll have that, all of this will be recorded and posted online. We'll also send out a survey just to get your feedback about the event. So you will be getting that after today.
That survey is also in the chat if you want to do it right now. And then I also put some links to a couple of other events coming up that we'll be speaking at or supporting if those are of interest to anyone.
And Sandra says, did we discuss the mental aspects of bullying? That's a good one. That's definitely something that we can provide you with more information about in a follow-up email. I don't know that we really touched on bullying, but yeah, that would definitely impact mental health.
I will just jump in to say that I mentioned earlier about some rules that were being promulgated. Did I say that correctly? For the safe and supportive school programs, they did write in there, at least trying to weave in bullying prevention and intervention as part of that broad safe and supportive school program. So at least there was some acknowledgement that schools should be doing it, but I think it just goes to show that it's a critical piece that, you know, needs to have more attention paid really on the prevention and intervention aspect.
Thank you, Josette. Well, with that, it is 3:01, and I thank you all for attending today, and a special thank you to our guests, Josette Saxton and Lauren Rose. And we hope to continue this conversation with you guys.